How's the new book going?
The
Oh,
book,
we have a new book?
yeah, the new book came out and it is it's selling pretty well. I sell it in my office and it's also available on Amazon. And I have to say, people are saying nice things about it. I like it. There's a few nice reviews on Amazon. And somebody has approached me now to think about writing a novel because there are a lot of things within my experience of going to medical school, being a resident, becoming a physician, having my own practice that I would really like to put in a book. But if I put it in something like a memoir, it would really involve way too many secrets about people. So somebody suggested to me, you should write a novel about a doctor who did a lot of these things, who's not you. So I said, that's probably a full-time job. So I may think about that in the future. But yeah, I'm happy with the way it's going. People have appreciated kind of hearing about my point of view of having my own kids and going through labor and delivery as a medical person and what that has been like. And it's a lot of stories there.
It's a different perspective that I don't think many people hear about. I think people we think of oh, doctor, but we don't think of a doctor having babies and having a family. We don't think about it. So it's good to have it out there.
I recently had a patient come in who I said, I'm not saying it's really you. I said, but you should read the first chapter in the book because it's kind of you. So she said, oh, now I'm going to buy the book. And she said, yeah, I remember that stuff happening. And, no names. And a lot of the things have been changed and embellished, to make it readable and not particularly about anyone in particular, but she saw herself in there. And so those things really did happen.
Yeah, I gotta wonder when you write a book and you're writing about real providers and real patients, it's do you sit there and go, well, I'm gonna leave out a few details, not because it's going to identify them, because it might not make them look as good as they could. It's this is not necessarily their best selves.
Absolutely. Well, there is one story in the book that is about a patient who wanted to have a home birth, but didn't tell me that and came to me for her whole pregnancy. And then in the end, where she had some complications and I said, you really need to go in, we need to get your induction going, and just never showed up at the hospital. Come to find out, she planned to deliver at home the whole time without telling me. And the story is not only about kind of the deceit of that, but also about the perspective of looking at it why could she not trust the medical community? Why could she not trust me to tell me that? And the anger at, somebody kind of keeping me waiting in the delivery room when she never had any intention to show up there. And in the end, it was one of my midwife friends who actually said to me, it's not personal. It's not about you. It's about her not thinking that she could get the experience she wanted if she told you. And, I had to look at it from that point of view. Otherwise, I know myself, I spent a lot of hours being hurt and angry and upset and all that. But I think when my midwife friend said that to me, I just felt sorry for her. I did. And for people at large who feel like they can't get the informed medical treatment that is good and that they want and that is safe, because they feel like it's not out there. And I felt badly that I was not able to provide her a way to understand that that was through me, but so that story's in the book. And I have to believe that the person who did that probably knows that it's her, if she ever read my book, which who knows. But it's an interesting take on it, because you guys all know people and personal stories of people who thought, yeah, delivering at home, what could go wrong, right? And yeah, we all know that the end of that.
Something that I've always thought of, and this is just personal experience, especially after leaving the natural birth community, is something that I've always noticed with my friends is whenever somebody kind of keeps a secret. I had friends that would have these relationships, or they went off and they got married and stuff like that, and they didn't tell me they were actually in an abusive relationship. And that's why I wasn't told about it. And so that was something like later on looking at the natural birth community, that's something that's really in there where people really do keep it a secret. There is people that go to a doctor and then they tell them, yeah, I'm having home birth, and they don't, it's very like nonchalant, not a big deal. But then there's these other one where it's almost like they feel they have to keep it a secret for some reason. It's almost like protecting that community, protecting that thing, but it's not necessary. But I feel like that's something of like, I don't know. It's kind of like how now that I'm looking back, it's like that cult mentality where you have to like fit into whatever, and you can't trust the medical side. You can't trust. And then after I've been out, I was like, wow, it's such a different world to sit down with doctors or, nurses. And I'm like, wow, they're being more honest to me and actually care about me more than any of those people that were around in that community. So it's really just something that I've always noticed, like looking back at things, hindsight kind of thing. It's like, wow, the secret, if there's a secret to be kept, there's something bad around it. Just
if you're worried that somebody might judge you or ostracize you for being part of that community, you have to look at why, not to believe them in that all those other people are wrong and we're right. It's like, why does that have to be a secret? There's something wrong there.
Yeah. Exactly.
Well, the other thing is, if I'm correct, Danielle, no doctor ever had to tell you that they were being honest or tell you that they were being trustworthy. They just simply were. I mean,
yeah.
There's the old show me, don't tell me. And when it comes to anything, if someone has to constantly tell you, I question why they need to constantly reassure you.
Andrew just brought up, because our last video you were talking about how I was talking about my mom, how my mom was asking the midwife, do we have to be induced? Let's do something needs to be done. And looking back at that, it's kind of like when I look back at the appointments, which I don't like to look back at my appointments with her, I think about how she would constantly tell me, I'm the professional. I'm the one that has the degrees, the certifications. I'm the one that knows better for you. So when I would come with like a question or concern, like, is this normal? My body's doing this. This is happening to me. I'm uncomfortable. This is how she would just constantly brush it off. Like, it's normal. Everything's fine. You're a first-time mom. I'm the professional. You trust me. And I never I think that's why I don't like looking back at the appointments, is because I think about how she was like, in the other words I can think of, or she was grooming me my whole pregnancy to believe her. So when we got down to the end and there was concerns and there was things going on and all this stuff was happening to my body around me, and I was like, stuff's happening. She had already groomed me all these months to like believe her and trust her. And she's the professional. And she knows, like, you hired me and I know what I'm doing. I've delivered hundreds of babies before you. And so looking at that, that's exactly, I never go into a doctor and a doctor's like, you can trust me. Nobody, like, they don't say that. They're like, what's going on? Okay, let's look at this. Let's do this. Let's do this. Okay, there you go. They like handle the situation, and they don't say, you're a first-time mom. Oh, it's just pregnancy. It's never like that, because even when I questioned the next time around of stuff, I said when I went in right away, I was like, treat me like a first-time pregnant mom. I was like, because I don't know what I got from there. So just, that's how you treat me. And the doctors were always so super cool about it. They were like, yeah, okay, I'll explain everything. So they did. They explained everything. And so anytime I had any question, even if it was normal, and it's almost, some of the stuff could have been like almost laughable, it was that normal, they never were like judgmental. They never would. They just explained it, went over it, was like, this is this, this is this. If you notice this is not normal. If you said, if this happens, you need to call me. But this, you're okay, but thank you. Like, I actually did get thank you for being concerned about this and coming and questioning, doing stuff, because people ignore stuff and they don't tell their doctor, and all that stuff gets documented. So then if something later on, they're like, oh, we looked at A happened, but now we're B, C, and D. So it's all goes down in the thing, which I didn't know anything about until much later. And so that's the big difference looking at them, is they really do make you believe they are that professional. When you go into an actual professional setting, they don't have to make you believe that, because they are professional. That's what they are.
Anything that has to do with secrecy or not wanting to tell somebody the whole truth, or, keeping something from the doctor, that you have to question why you would feel that way. It's not allowing me to take good care of you if you're not telling me the things that I need to know.
Do you ask about any traumatic history?
On You mean on a history taking?
Yeah.
Yep. We have part of when a patient comes for the first time, and also when they're first newly pregnant, we have like a series of very detailed questions, especially in the part that we call the social history, which is, about your habits, your exercise, your diet, your relationship, all of that. And part of that is, are you in a relationship, or have you ever been in a relationship where you've been afraid? And tell always anybody who's had a past pregnancy experience. For me, my first appointment with them always goes over. I always say, so I want to hear in detail, because as much as people kind of say, yeah, I had a baby, it was vaginal delivery, it was fine. Then when you say, I want to hear in detail, walk me through your whole pregnancy, your labor, your delivery, and your postpartum period. Boy, does a lot of information come out with that. As far as, I just had somebody recently who's about 20 weeks pregnant now. And I said, tell me about your last pregnancy. And by the time she got to the postpartum period, she was crying because she had postpartum depression so badly that she felt like that might happen to her again. She's already feeling that way. Like that never would have come out unless we had the conversation about the last pregnancy and delivery. So I said, this puts you at risk for that happening again. It puts you at risk for it happening now. There's no need to tough it out, send her out with an appointment to see a counselor and information and to talk to someone. And yeah, you have to get all that information first to know how to help them now.